I think Mahesh mentioned that flexibilities are being given in accelerated approvals. What learnings could we gain from these approvals that could be or are being considered to be applied to regulate developments? You've got obviously a view on risk, but it's possibly more balanced or more carefully considered than checkbox on the current process.
I love that question. This is very interesting because if you asked this question 7 years ago when we first rolled out Fidesia, we started with the early phases of breakthrough therapy. I would have answered with a little differently. But today, I think what's unique is that over the last 7 years, working in these programs, there's a very different philosophical approach, right? So when you go into these accelerated programs, you're asking, really paring it down to the so what kinds of questions, right? So if I don't have this information, or I do have it, if I see this risk, or I don't have this uncertainty, so what? What is the actual impact of the patient, the reliability of the safety profile, the efficacy profile? And that sort of discussion is forced in an accelerated program between clinical folks, non-clinical folks, quality folks, and even investigators out in the field. I think what has been cool to see is that over the last couple of years, even though not every program is designed for that sort of approach, that philosophy has permeated into other programs because it really is a better risk-based way of doing things. I have to be cautious in what I say, though, in that not every program is an all-hands-on-deck kind of approach. Not every program affords itself to that sort of risk-based flexibility. If we're talking about the 15th generic on the market, that flexibility may not be as flexible as compared to the first life-saving medication on the market. But you can feel internally that there is a different sort of risk-based thinking because of the exposure to these kinds of programs. So I think what has happened, right, is a change in philosophical approach, a change in the behavior of our assessors and investigators to be more practical in the way that we enforce expectations. So that's what I would offer.